When you concentrate your energy purposely on the future possibility that you aspire to realize, your energy is passed on to it and makes it attracted to you with a force stronger than the one you directed towards it. Words of motivation from Stephen Richards, author, film director, and producer. If you have been delaying going after your dream, now is the time to apply this quote and move ahead with positive energy. Hello there, I'm Adrian Atkinson, and you're watching Jamaica Magazine, the show that inspires, educates, and informs.
Good day, I'm Theodore Henry, and this is your JIS News for Thursday, April 21, 2022. Arrival figures are indicating that this winter season, closing at the end of April, is going to see in excess of a 70% recovery in tourism for Jamaica. That's the word from Tourism Minister Edmund Bartlett. Inclusive of cruise passengers, he says Jamaica is looking at just under 1 million visitors and earnings of about $1.5 billion US.
But that's not enough, because I have to tell you a little more. Summer is now tending, and the bookings for summer is looking better than 2019. That is pre-COVID.
Minister Bartlett was addressing yesterday's groundbreaking for Riu's 7th hotel in Jamaica, the 753-room Riu Aquarelle. To build on the rate at which Jamaica's tourism industry is recovering from the devastating COVID-19 fallout, the minister is set to leave the island with a team this Friday to start a mega marketing campaign across the world. The first stop is in the United Kingdom this weekend, where he will join Culture Minister Olivia Grange in promoting activities to mark Jamaica's 60th anniversary of independence. The tourism team will move on to New York to stimulate travel from the U.S. northeastern seaboard, inclusive of New Jersey, Connecticut, extending to Boston.
And then we leave from there and we hit the new market of the Middle East. We're meeting with all the mega airlines. We're meeting with Emirates, we're meeting with Etihad, we're meeting with Qatar, we're meeting with Saudi, and we're going over to Riyadh as well to meet with KGAG, which is their big aviation company. They want to open 225 new gateways, and we want Jamaica to be in that.
The itinerary also includes a meeting with representatives of Royal Jordanian Airlines, as a plan is being rolled out to establish Jamaica as the hub for the Middle Eastern market in the Caribbean and the Americas. With breaks in between, the marketing tour will also go on to Africa, Canada, Europe, and Latin America. At the end of the Global Marketing Blitz in October, Minister Bartlett expects to have agreements signed for an additional 8,000 new hotel rooms in Jamaica. Meanwhile, Prime Minister Andrew Holness says the Tourism Enhancement Fund, TEF, will be providing financial resources to upgrade designated public beaches for the enjoyment of Jamaicans. He says, where applicable, each beach will receive changing areas and restrooms, perimeter fencing, parking, children's play areas, seating, walkways, electricity, and sewage treatment facilities. The Prime Minister reported that 3 beaches have benefited from these enhancements thus far, with several more being targeted.
We hope to at least have one in every parish to ensure that our people can have the free access, benefit, and use of what is theirs.
Prime Minister Holness was speaking at the groundbreaking ceremony for the Riu Aquarelle Resort in northern Trelawney. The new resort is set for completion in 2023. Another 3 major fire stations are slated to be officially opened this year. Minister of Local Government and Rural Development Desmond McKenzie made the disclosure at the recent opening of the Jamaica Fire Brigade Station in Old Harbour, St. Catherine. The other stations being built under the Jamaica Disaster Vulnerability Reduction Project are the Montego Bay Fire Station, located on Barnett Street, the Yallas Fire Station in St. Thomas, and the Port Maria facility in St. Mary.
We're going to be turning our attention to Ulster Spring in short order. And then we're going to be moving to Balaclava. We are going to conclude the arrangements for Papine.
Entities will now find it easier to register as cooperatives and friendly societies as the Department of Cooperatives and Friendly Societies (DCFS) has officially launched its online registration and monitoring system. Minister of State in the Ministry of Industry, Investment and Commerce, Norman Dunn, says the project aims to reduce the delays faced in completing registration, as well as to improve data management and reporting and strengthen the department's capacity to develop social organizations.
The ease of registration that will come as a result of the online system frees up the technical team significantly so that they can refocus their energies and to engage with the social organizations that they are registered with at DCFS.
The initiative was supported by the United States Agency for International Development, USAID. It will modernize the way the DCFS does business with its more than 500 Provident societies, 158 cooperative societies, and the 442 societies registered under the Friendly Societies Act. The Ministry of Health and Wellness says the Omicron BA.2 variant of COVID-19 is now confirmed to be in Jamaica. In a statement earlier today, the ministry says the latest gene sequencing results from the National Influenza Center at the University Hospital of the West Indies finds that the BA.1 variant remains the dominant strain, but 2 samples tested positive for the newer BA.2 variant. 89 samples were tested between January 1 and March 4, 98.9% of them Omicron variants and 1.1% Delta variant. Of the Omicron samples, 2 of the 88, or 2.3%, were BA.2 variant and 97.7% were BA.1 variant. According to the World Health Organization, WHO, the BA.2 variant is the dominant strain globally, with the type of illness associated with this variant being similar to the BA.1 variant. Chief Medical Officer Dr. Jacqueline Bisesa McKenzie is cautioning that while the majority of cases appear to be mild, this is a highly transmissible variant which may result in an increase in number of COVID-19 cases. This puts persons with comorbidities at greater risk for contracting the virus and developing severe illness, while persons who have mild or no symptoms may be at risk for developing long COVID. Dr. Bisesa McKenzie is urging members of the public to continue practicing infection prevention and control measures, including the wearing of masks, hand washing, physical distancing, and staying home if you are sick. Persons are also encouraged to visit any of the over 200 vaccination centers across the island and give themselves greater protection from the worst effects of COVID. And finally, the National Meteorological Service has discontinued the flash flood warning that was in effect for the island since Tuesday. The trough that caused major flooding in sections of Jamaica is expected to remain in the vicinity of the island for the next few days. Periods of showers and thunderstorms are anticipated across parts of most parishes during the afternoons. From Tuesday's rainfall, the search is still ongoing for one individual that was reported missing. And that's it for JIS News Today. I'm Theodore Henry. Thanks for watching.
Informing.
Jamaica today confirmed its first imported case of coronavirus.
Educating.
If you follow the recommended procedures, it is highly likely that you will not get the disease.
Going beyond to keep you informed and connected.
Welcome to Get the Fact.
Even through the pandemic. Helping you stay safe while we protect ourselves. Dependable. Impactful. Accurate.
This is your JIS News.
Credible. Trustworthy. Every day, everywhere. Serving our customers proudly.
It's convenient, easy to use, and can be done from the privacy of your home. What am I talking about? The HIV self-test kit, because knowing your status is important.
The National Family Planning Board takes pride in launching HIV self-testing as another option for persons who want to know their HIV status. And yes, it is here. We're putting this product into the hands of members of the public through a very important public-private partnership through the pharmacies, and this will facilitate our reach to a wider audience. This kit allows persons to self-test within the comfort of their homes or to opt for self-test at a healthcare facility. You and your partner can do the test. So we're encouraging the sexually active persons at high risk to make use of available kits to determine their HIV status.
The National HIV Program is continuing its mandate of ensuring the provision of care through this new modality. This joins existing modalities of provider-initiated testing and counseling offered at our health facilities, outreach testing provided by our prevention team, and targeted testing through contact tracing and counseling. Testing allows for two things: the indication of a positive test or the provision of a negative result. For all persons who do self-testing, there are also avenues available for prevention, for treatment, and counseling. So we're not just sending you to do a self-test at home. All health facilities in Jamaica can guide you through the process of a positive or a negative test. However, there are 44 treatment sites in the public and private setting that you can go to get expert treatment and management of any HIV condition and HIV itself. The listing of all these health facilities is available on the Ministry of Health and Wellness's website. It will be available at the pharmacies that will be doing the self-testing, and it will also be available on our NFPB website. This initiative by the Ministry of Health and Wellness through the National Family Planning Board is welcomed as Jamaica moves towards epidemiological control of HIV.
This fits into our sustained effort to have more persons being tested for HIV, as well as increase the number of persons who are aware of their HIV status. Globally, the body UNAIDS has had challenges back in 2020 to have a 90% of all people living with HIV to know their status. Another 90% of people to be diagnosed with HIV infection receiving sustained antiretroviral ARV treatment, and the last 90 of persons to be on antiretroviral treatment to attain viral suppression. No, the wider availability of the HIV test has the opportunity to ensure the realization of the first 90 targets. Success in this endeavor will mean we can end AIDS pandemic by 2030. The challenges to the continuum of care are being addressed by the program. This is one of the things to definitely make that happen. Checking our HIV status, especially if we are sexually active and not using protection. This is important for you to make sure you get this self-test kit.
You have the fluid for actually conducting the test and your swab stick that you will use and test for your results. Now, when persons hear about the oral test, they usually think that it's just push it into your mouth, but we don't want to be testing the saliva. You actually need to rub along the gum line, both top and bottom of the gum, to ensure, and it's kind of, you have to do it hard to ensure that you are getting the cells. And you insert it in the container. Now you'll have to wait for 20 minutes to read it. It is suggested that you read at 20 minutes, not long after, not before. So there you go. Your results will be presented here. If you get a reactive or a positive result, you need to ensure that this result is confirmed through a confirmatory test. So you can go to any one of our treatment sites to get a confirmatory test done.
We are proud to partner with the Ministry of Health and the National Family Planning Board, and we are pleased to add this to our list of services. This is indeed a step in the right direction as we empower our communities to take greater control of their health.
We are confident that the purity of intent of the National Family Planning Board to make Jamaicans aware of their HIV status will indeed contribute positively to the general health and wellness of our citizens. I know that a lot of persons' life will indeed be enhanced by this venture.
There you have it. HIV self-testing is now here. You can go ahead and access these test kits at participating pharmacies across the island. And follow us on our Instagram, Facebook, and Twitter pages to get more information about where these test kits are available.
We need all Jamaicans to know that child abuse is not just an issue for the government, it's an issue for all Jamaicans. So we need everybody to help us to protect our children. If you know of a child who is being victimized, a child who is abused or neglected, just make that report so we can get that child the help they need. Calling or reporting is easy. All you have to do is remember to call 211. If you are an adult, if you're a child, if you are in church, in your community group, wherever you are, once you are aware there's a child who is in need of care and protection, just be the one and call 211.
The process of coping with the loss of a loved one is not the same for everyone, but there are a few common signs to indicate that you should seek help in managing the stress that it is causing you. Consultant psychiatrist Dr. Jeffrey Walcott explains the signs we should look for.
Welcome to Get the Facts, the program that provides you with information on government's policies and initiatives. I'm your host, Enthros Campbell. Now, today we'll be talking with consultant psychiatrist Dr. Jeffrey Walcott on how to cope with the loss of a loved one. Dr. Walcott, welcome to the program.
Thank you for having me.
First, explain the impact of the death of a loved one.
Well, you see, most persons experience loss differently,
yes,
but there are commonalities. But I think one of the most important things for us to recognize is that dealing with grief is a normal human experience. It's something that we have to go through. It's inevitable, and it's not a pathology. In saying that, however, we recognize that it is painful and can be immensely painful for persons who are experiencing, depending on how close they are to the person that they have lost. And so there's been a sort of framework that has been developed to identify the emotional states that persons go through. Dr. Elizabeth Kubler-Ross had developed a pattern of grief that we see. And initially what you see early in the loss is the business of denial. Persons end up in shock because you can't process it at the immediate impact of the event. And then persons go through feelings of anger, you go through stages of bargaining, and then eventually you then start to have the feelings of depression and finally acceptance. Mm-hmm. And those steps are not clear or linear. In other words, people can go through various stages at various times, and there's no time limit. So each person is different, but what you require during those stages remains somewhat similar. People need information, they need connection, they need support, emotional support, and at the end, they need guidance and some amount of direction as to how to get their lives to move on. while incorporating the loss that they've gone through.
So would the impact be different depending on the age of the person?
It does, and depending on the experience. Persons who have dealt with loss before tend to be more resilient. Resiliency is a trait, not a character trait, but it's a learned process that we develop over time. The more difficulties we go through, the more adversities, the stronger we are at dealing with future events. And so persons will vary based on experience, based on age, based on stage of development and psychological strengths. So it tends to be different with each person, but some of the commonalities are they all need support. They all need a shoulder or a listening ear, and we all need a supportive community around us.
Talk to us about some of what we should look out for, the signs that we would see and the kind of behavior in persons who are going through this kind of grief.
I think one of the important hallmarks or triggers for the intervention process is withdrawal. Persons who are going through any form of psychological pain or suffering will have a normal tendency to withdraw, and that's the wrong and counterproductive thing to do, because at this stage is when you actually need to have the support of persons around you, not necessarily to discuss what's happened, but just to be there, just to be in a safe space with persons that are supportive, that are sharing in the grief. And that's why when you look at how almost every culture deals with the process of loss, the actual rituals are quite similar. It has to do with coming together of communities, coming together of families, because we know that those things are impactful in allowing persons to process the loss and the trauma in a healthy way. And so it's important to recognize and counter when persons are trying to isolate or withdraw and offer them help.
Right, so we don't necessarily need to try to get them out.
Not necessarily, just to be there and just to check up on them. Even if they sometimes don't want you to call or don't want to say, still do it. Give them the option or the opportunity to engage with persons once they're going through this pain and not to go through it alone.
Okay, so what other signs can we look with? So there's withdrawal, are there any kind of other signs?
And I think what a delineation is to identify when clinical or significant impairment has occurred where we'll need professional help. And I think that's where I alluded to. But the issue is once you have changes in your sleep patterns, your appetite, physiological changes. In other words, you're being impaired now, first physically and then psychologically, not able to perform at work, not able to do your normal daily routine. And then that may be a need for some level of professional intervention. But it's important to understand, because most people view psychiatric care or psychological care as an intrusion or as somewhat of a forced entity, but it's really not. We're here to help and to provide support as much as you need. Most, if not all, the public health facilities have mental health services attached to them in the nearest community clinic that you can have. And there's a plethora of both private and public entities that provide psychiatric and psychological services. And the Ministry of Health actually has several helplines that they have created to be able to direct persons to access psychotherapeutic or supportive psychotherapeutic services and mental health services all across the island. So all you need to do is to reach out to one of your health facilities or even your private practitioner, and they can guide you to accessing mental health care, both in the public and private sector.
We want to remind you that exercise is important and that you may get help at the clinic in your community. So do not be afraid to go to the clinic. We're talking to Dr. Jeffrey Walcott, and he's a consultant psychiatrist. Thank you so very much for watching, and we see you next time when we have another interesting program. I'm Rose Campbell. Take good care.
Develop a sense of purpose. that says you're not here by accident. You are here for greatness. You are here with destiny in mind. You are supposed to do something great, and you are on that pathway. There are persons who are in the departure lounge of life, at the end of their life, and they look back and they have regret because they never took time to uncover and develop a sense of purpose. Why am I here? What am I supposed to do before I leave this 7 billion people planet called Earth? What am I supposed to accomplish? Having a sense of greatness that's in you. You're talented, you have gifts and abilities. Some of you are good with numbers, some of you are good with words, some of you are good with both, some of you are artistic, creative, some of you are sports oriented, and there are many things. And you take time to discover what are you passionate about. What can I just do naturally? I can jump out of my sleep and do it easily. Speaking now to your talents and abilities, your giftings. All of these come into your sense of purpose. The things that you are to do in life as you are to impact people. When you dream, when you close your eyes, what do you see yourself doing? And knowing that the sky is the limit. Second thing I want to say quickly is that you must learn to persevere. I heard Marquis speak about perseverance. Everybody say perseverance. Sometimes we don't achieve much because we give up too easily. You have to learn, if you want good, your nose have to. Yes, man, you have to get your feelings hurt and still go on. When I was doing my PhD, boy, a man tell me, man, people seem to like you. Wayne, why don't you just leave this program and go back to your country? You have a master's. The PhD is not for you. Why don't go and make money? And that was a racist comment because I was black. I was the only black person in the program. And he was saying things that hurt me, and I didn't want him to see me offended. I left his presence, went into my room, and I cried. But I decided to continue in my effort for excellence. Are you hearing me? And so perseverance means to continue a course of action in spite of difficulty, in spite of opposition. When they fight you down, when bad mind reach you, and they're fighting you down, and they say you're not the right gender, young ladies, and they say you don't deserve to be here, don't pay no attention, press on nonetheless. And it means you also have to have the right people around you. Be careful of the company you keep. As you go through life, you're going to make mistakes. As you go through life, you may fail at something. You want people around you who can encourage you to get up again.
This is where our journey ends, but only for today. Do join us again tomorrow when we'll bring you another informative program. In the meantime, stay connected via our website, jis.gov.jm. And while you're online, send your feedback to Jamaica Magazine at jis.gov.jm or via tweet at JIS News. You may also find us on all the major social media platforms and through our mobile app that's Android and iOS compatible. On behalf of the entire production team, I'm Adrian Atkinson. Do take care.
This has been a production of the Jamaica Information Service, the voice of Jamaica.